people are beginning to talk about mental illness and mental health in a way that they haven't before.
Do you see real hope for change in the mental health services in the future?
I do, actually. I mean, the fact that people are raising funds, I think will really, there'll be more money for services, so I find that very hopeful.
What about research? How important do you think research is to uncover new methodologies for treating specific disorders?
I think it's absolutely key. I can see my mother takes different drugs, and I can see the effect that that has on her in a positive way. So I think that the research is absolutely key to helping people with mental health problems.
Yes, I was very surprised to see how many people were here and how many people I know. It was very, very nice to see all the people here. I'll certainly come back here next year. I have 3 young kids right now that take a lot of my time, but yeah, this is something that I'll come back to for sure. Yeah.
I was invited to attend. I've come to the event for the last few years and I've quite enjoyed it, and I'm here to help.
What difference have you seen in the last couple of years in terms of the community involvement in mental illness?
Well, it's what I most connect with is when they make a statement of how everybody is touched by this, and you know, there's not anybody I know that it isn't touched by. So that's why I'm here to help, and you can see each year how this event grows and grows, and I think it's really contributing or really helping out to add to the funding of mental health.
What do you think about funding research as we move forward with this campaign? How important is that?
Well, it's critically important, given the size of the problem and the effect on our youth, which we saw today. The youth is our future, so hopefully some of this research will help out with our kids and get them to lead us in the future.
Pat Talon, I'm with Xerox Canada. I'm a board member with the Royal Ottawa Foundation. I was a table captain. I'm on the organizing committee as well. I recognize the issues that mental health present not only to individuals and families, but also to businesses. So it's a cause that's very important to me.
Can you talk a little bit about the impact on business?
Well, it was mentioned this morning, 1 in 5 people is affected, and you think of the number of people in the workplace, it's pretty easy to do the math on that. I've seen it in our workplace firsthand as far as the hours missed, the days missed, the productivity missed, the impact on people from a personal level, and the difficulty many individuals have in reintegrating back into the workplace. A lot of that has to do with the stigmas attached. A lot of it has to do with the fact that people aren't as accepting of it as they should be. And I see it all the time. I see it as probably the biggest issue as an employer that we face from an employee productivity standpoint.
We heard some stats today that 30% are treatable, 30% can manage, and 30% are untreatable. That's not acceptable.
No, I find that astonishing. When you think about the fact that 30% of people would be in a category that you would say are not treatable, and there's probably not another illness out there that you would have those kinds of figures. And if you think of cancer, for example, you'd never have a situation where 30% of the folks are not treatable. There's always hope. There's always an opportunity. Now, of course, many of those cases also end up tragically also. But when you think of the fact that 30% of people don't have a chance for recovery, it's really terrible statistics.
Research is the key to changing that statistic.
Yeah, research, awareness. You see a lot of people don't even get the chance to recover because they don't speak to anybody about it. So if you're reaching out to people, they're having a chance to speak, they're having a chance to be recognized by loved ones or people in the workplace or family members. If they have an opportunity to be treated, then at least they have a chance. But many of these cases you hear about, they never have a chance because they don't put their hand up. They don't reach out and say that they're hurting. They're really hurting inside.
It was a tough event. I think I was okay until I saw some people I knew. Thank you. It was a nice story to tell, but a sad story.
So you're a committee member?
I am a committee member. First year.
Involved through your connection with your family?
Involved from my family. Richard Getz, our committee chair, actually, and I were having lunch about 6 months ago, and he knew my family story and asked if I would help. Well, I know it's important, obviously. We heard Rachel's story, and we know that she's been trying many different kinds of medications and not all helping. So I think it's really important to try to find something out there that's going to work for these people who are in dire straits, I guess.
There's people that just seems the system currently just can't help.
That's right. There are a lot of them out there. It isn't right, and it's very sad to hear those kind of stories because you don't know how to help them.